forward to this. All right. Well, let's get this party started. Welcome to our Building the Future Social Work Career Opportunities Workshop. My name is Dr. Stacy Deck. I am the Director of Undergraduate Education in the School of Social Work. We actually offer 3 degrees at Spalding University for social workers. The first is the BS in Social Work, is an undergraduate level degree, and that's my program. The second is an MSSW, a master's in social work, and our program director is Dr. Leslie Cairo. Brittany, are you done with that program? You currently enrolled?
I'm currently enrolled.
I thought you were. Okay, so you can speak to that if questions come up on that. I'm actually teaching one course this year in the master's program, but when I started at Spalding, I was about 50% in that program. And then we have a DSW, or a doctor in social work program. And to contrast that with a PhD in social work, which is more academic focused, so research and teaching focused. A DSW is leadership and clinical practice focused. So there are actually 2 pathways within the social work profession now. And then there are lots of kinds of certifications as well for social workers. And many of our panelists, welcome, Sarah. And I'm just getting started. I'm just kind of laying the groundwork. Many of our panelists have extra letters after their names. So we're going to talk a little bit about licensures and certifications as a part of the career path process today. I think what I'd like to do is invite our panelists to introduce themselves. And let's have you do this. Tell us your name, tell us your job title and where you work, and give us those letters after your name. And if you would, like, say MSW, which means Master's in Social Work. It's a graduate degree kind of thing, and I'll help you with that. And then if it's okay, I might just, since we're a small group today, have our participants quickly introduce themselves. And here's what I'm going to, so that you all can be thinking about it. I would love to hear, are you exploring opportunities? Are you thinking about being a student? Are you enrolled in a program? In other words, what motivated you to be here today? Because that'll help us to make sure that you get your needs met. If you had a particular question that you're hoping that we'll touch on, you can let us know. I'm going to just go around the screen because it's always awkward to figure out who goes next when we do these things on Zoom. So I'm going to start with Pat McKiernan.
Hello, everyone. My name is Pat McKiernan, as Dr. Stacy Deck Shade shared with you. She is somebody that I'm very familiar with. We actually worked together way back in the 90s at Volunteers of America. Yeah, so anyway, yeah, she was way younger than me, and so, just remember that. And so she got her doctorate when she was 17. She's a genius. But anyway, so my background is I'm an Alejandro counselor. That's what I did at Volunteers of America. That's what I did with the Kentucky Department of Veterans Affairs. And that's what I do mostly now as in my private practice work. I also have a bachelor's degree from the University of Louisville in counseling and guidance, a master's degree in applied addiction studies from Nova Southeastern University, and a PhD from North Central University. So my PhD is in psychology, by the way. And I've been working with Spalding for about 20 years, teaching classes in the specialization or the special topic area of alcohol and drug counseling. So that's enough about me. Thanks.
Yeah. So if you have an interest in the mental health / addictions recovery specialization of social work practice, Pat's your person. Pat mentioned that he teaches for us as a part-time instructor, and we have a minor in addiction studies at Spalding University that you can combine with actually any degree. It pairs very nicely with the social work degree, but we have students across the university who are completing this minor. And there are a bunch of little 1 credit hour addiction studies classes that Pat in particular teaches. Hey, Pat, you have a PhD, you told us, in psychology, and your certification is an LCADC. What does that mean?
Right, I forgot that. Yeah, I'm a licensed clinical alcohol and drug counselor.
All right. So,
Yeah.
if we have a special interest in that, we can talk about the licensure pathway for addiction counselors. Let's go over to Brittany. Tell me your last name because it's changed since the last time we talked.
It has. It has. I got married over the summer.
Congratulations.
That's new. The name change is new. Thank you. My name is Brittany Elam, and I'm currently the policy specialist with Kentucky Voices for Health. It is an organization that it started in 2007 and really lifts up the voices of consumers in the healthcare space. And so it's a new position for me. And I started about a month ago, and I've been wanting a job in policy. And so I've just been applying like crazy everywhere, and they hired me. I got my bachelor's degree in social work with a minor in addiction studies from Spalding University, and I'm currently in the master's program at Spalding University.
And I'll just piggyback on that because Brittany finished a bachelor's in social work. She actually came into our graduate program with advanced standing, which means the bachelor's degree covers all of your foundation content in the social work curriculum. And you really jump just to the second year of our 2-year master's program with that advanced standing status. If you have a degree in something else, like let's say psychology or even accounting, you still can enroll in our master's program. It would be a 2-year program then. So if you do the two in conjunction with one another, BSSW flowing into MSW, it's a 5-year pathway. Some people do 2 years at community college, so 2 years, 2 years to finish your BSSW, and then 1 more year for the master's. So it could be 4+1 or 2+2+1, but it's a very, very smooth pathway. Some people will put a little gap between their bachelor's degree and their master's degree, but a lot of our students do what Brittany did and just kind of roll right on along with their cohort members for that good interpersonal support. Yeah, let's go to Billy.
Hello, everyone. My name is Billy Jenkins, and I serve in Jefferson Service Region, which is a part of the Department for Community-Based Services, Protection and Permanency Division, also known as Child Protective Services to many in the community. I serve as a Service Region Admin Associate, and I've been working with the cabinet for 28 years. And so I started back in the late 90s as a frontline social worker. And now I serve as part of our regional leadership team here in Jefferson Service Region. And I got my bachelor's degree from University of Louisville in Justice Administration. I also received my MSSW from the University of Louisville as well. And currently I have responsibilities of providing oversight and some individual one-on-one supervision to practicum students in the region. And I also assist with a lot of community engagement with our region as well.
Thank you. I'm going to piggyback on yours a little bit to highlight the CW Prep opportunity. CW Prep stands for Child Welfare Preparation. So it's an acronym, all caps, CW space Prep. And Spalding University is one of a consortium of universities statewide that has partnered with state government, the Cabinet for Health and Family Services, to prepare future child welfare workers. So that could be child protective services. Some child welfare workers work in juvenile. Help me out, Bella.
The Department for Juvenile Justice.
Yeah. Yes. Okay. Also, adoptions is under the child welfare umbrella, and transitional care for folks that are in out-of-home placements would also be under that umbrella. It's a very nice opportunity for people who think that they might like to do this kind of work professionally, because you can actually get certified at the same time, in the same time as it takes you to finish a bachelor's degree in social work. The cabinet is very motivated to attract and retain well-prepared social workers who are ready to do this work skillfully and compassionately on day one. And so they are kicking in. They, in the junior and senior year, they provide tuition support. They provide a stipend that can help with books and expenses. You do your practicum placement with the cabinet in a child welfare position with a experienced child welfare mentor, and they actually pay you an hourly rate, I believe, for your practicum hours. And then you are obligated in exchange for all of that support to accept an offer of employment when you graduate and to stay there for at least 2 years, which is kind of the payback time. But I will say, I always like to turn it around and reframe it. Another benefit of the CW Prep program is that if you do a good job, and you will, you're going to have a job offer when you finish, right? And actually, that's true for many of our practicum opportunities, but there's some extra bells and whistles here in terms of financial support. So that's a really nice piece. And Billy can certainly speak to that. He's actually supervising one of our students in practicum right now, who is a CW Prep participant. Before I forget, I want to circle back to Brittany because she told us about her new position. But Brittany also has this amazing background in advocacy for justice-involved young people. And so one of the topics that we might want to talk about today, if you have an interest in that area, is criminal and restorative justice. And Brittany has testified in front of the state legislature. She has written in the public press as an advocate and kind of a survivor of the juvenile justice system. Is that a good way to put it, Brittany? So I want to make sure that we bring that out as well. Let's go to Emily, last but not least.
Good morning. My name is Emily Coons. I am the program coordinator and social worker for Frazier Rehab's spinal cord medicine program. And I have an MSSW, so that's just a master's in science and social work. I got my undergrad at Ohio University in social work as well, and then I did my master's at UofL. And I have a CSW, so that's certified social worker. I'm not clinical, but I hope to be someday. Hope to be someday. Just have that under my belt. Let's see. What else did you want to know? I think I also had experience. I also did the child welfare prep as an undergrad, and worked in child welfare for several years. Yeah. So it was a really great program. I can definitely attest to that. Yeah, I don't know. I did a little tiny dabble in school social work where it almost not mentionable.
Hey, but you know what? I'm gonna piggyback on yours. Everybody has given me just like all these ideas and things that I want to put out there. Emily, you were a poster child for the idea that social work is a very flexible degree and a very flexible profession with a lot of portability of skills. Our degree prepares you for generalist practice. What that means is you are prepared to work at any level, from the one-to-one, very clinical stuff like Pat does in his private practice, to families and groups, the kinds of family systems that Billy and his staff are working with in child welfare, all the way to the macro level, which is systems and communities and policy work and research work, the kind of work that Brittany is doing now. So from micro to macro level, with any client population, and we've heard about, several already today, in any setting. And the idea that you have this generalist training, and then you can add a minor, you can add certifications, your experience obviously is going to give you some level of specialization. You kind of get the best of both worlds. But if you come to a place in your life where you're looking to do something different, or a transition, or maybe just, for life balance reasons, you need a different kind of work, it is very easy to shift that experience into a different setting, a different population, a different level of work. Yeah.
Sorry, I was going to say that's very true. And I also forgot to say that I'm a part-time instructor at UK as well for their social work program.
Oh, cool.
So yeah, I've done a lot of stuff, and that is why social work is so great. It's because it is so versatile.
A lot of people don't realize that social workers are in healthcare settings. And so we have a lot of folks that come as new undergraduates to Spalding, and their initial major is nursing or occupational therapy or physical therapy or something like that. And then they realize they don't love math and science. And what really was tugging them into those majors was the idea that they wanted to help people. And when they discover social work is that same helping, coming alongside of people, helping them to grow and achieve the kind of life that they want for themselves, and that you can actually do this in healthcare settings without having to be a nurse, a physician, it's almost like the lights go off. It's, best of both worlds, right? We don't have a school social worker on the screen today, but I will say my first degree was in elementary education. So I have a little bit of that in my background if that comes up. Let's hear from the people, our guests today. Just a brief, you can tell us your name. And I'm going to ask the question in a very broad way. Why did you show up today? What are you hoping to get? And if there's a particular area that you're interested in, you can let us know. Sarah, since your camera's on, can we start with you?
Sure. So my name is Sarah Aporta. I came today because like the description talked about just learning different fields and pathways in social work. I am in school at JCTC right now. We'll graduate in May with like an HMS. And I'm planning, I haven't actually chosen yet, which I need to make a decision, but it's between Spalding and Campbellsville. And I plan to get a social work, bachelor in social work. And my plan is to do the advanced master's program as well. But I'm really excited that you guys brought up the CW prep because I haven't like committed myself all the way, but I'm very interested in learning more about that program. And I think I don't know, I think it would just be a great experience, even if, maybe come after 2 years after school, maybe even if I decided, hey, this isn't maybe what I want to like stay in forever. I think it would be amazing experience. And right now I work for 7 County Services and I've been here for like 5 years. I work with kids and transition age youth. So it's kind of like, I don't know, I'm feeling that that's the children and transition age is, I'm really enjoying working with this age group. And I'm also in recovery, and I know so I know that child welfare, I imagine, a lot of that's dealing with parents that struggle with that. And I always felt like I could just empathize, but yet advocate for the children. I don't know. I'm interested in the whole scene. So
all of it. Yeah. Thank you for being here, Sarah. Are you, is Bree Wechter your advisor?
Yes, she is.
Okay.
Yeah.
So we have a very smooth, Brittany, you transitioned from JCTC, didn't you?
I did. I love Bree.
Yeah, she's great. Yeah.
So, if you want to hear it from the proverbial horse's mouth, what that experience was like. And I'll just say this to all the panelists, if you're open to sharing your contact information, you can drop it in the chat for our participants today if anybody wanted to follow up with you. Sarah, I will say also, we have a couple of info sessions coming up about the program. I'm also happy to talk with you one-on-one, but a couple things I do want to highlight for you, since I know you're coming from JCTC, is we have a JCTC transfer discount, which gives you about a 50% discount on your tuition at Spalding. We are truly a 2+2. So if you finish an associate's degree, you are going to block transfer, which means no gen eds left at all. You're going to do 100% social work. There's the CW prep is also a possibility for some financial support. And because you're a 7 counties employee, we actually have 5 community partners, and employees of those agencies also get a tuition discount. I think the JCTC discount is better, but I'll say those out loud in case this applies to anybody that you know. It's Volunteers of America, 7 counties, Home of the Innocents, Maryhurst, and who have I not said? There's a 5th one. But ask me if, if your employer is on our community partners list, because that can also be a tuition discount. Let's flip over to Paula. I should have asked sooner. Is this session just for prospective BSSW and MSW students? Hi, Paula.
Hi, sorry. And I'm multitasking just a little bit because I am at work, so I had to take a call. So I wasn't sure. I should have probably asked that sooner. But do you want to answer that, I guess?
Sure. It's for everybody.
Okay. All right. I was just wanting to make sure because I saw the text. So I've actually recently applied for the DSW program there at Spalding. And so to answer your question about reasons for joining, one, I want to learn all things of what Spalding is doing and has to offer. And so since this was in relation to careers, also just trying to explore, opportunities for myself as well, too, as I, explore moving forward with a doctoral degree and then what career opportunities can exist. As you mentioned earlier, change is sometimes necessary, and social work has lots of diverse things to offer. Because I can relate to Mr. Jenkins. I've done child welfare before here in North Carolina. Haven't worked in the medical field in social work, but and worked in private practice. So right now I currently work for a public school system.
Okay. Excellent. Yeah, I'm glad you're here. And all of our, all three programs, when we offer events, we, cross publicize them. So, and this is very generally just about the career path for social workers. So I hope you'll get something that's of value to you.
Thank you.
Hey, Sanrisa. Sanrisa is actually one of my students currently. Do you want to tell us who you are and why you're here?
Hello. I guess I came because I was hearing that there would be social workers here and they'd be talking about their experience and stuff, and I was interested in hearing from that and just hearing them talk about their work and stuff.
Excellent. Love it. Well, we have done a lot of introductions. Social workers are good at that. Let's get down to some of the questions for today. I'm going to actually combine two questions, if I may, because I think they go well together, and then I'm just going to throw it out to the panel and y'all can run with it. I think we would love to hear, what is a typical day like in your line of work? And let me couch it a little bit this way. If you've moved into a supervisory role, you might try, can you back it up and talk to us about, let's use Billy, for example. You're an SRA, Service Region Associate. So you're kind of in a management role, but can you talk us through what's a day in the life of a child welfare worker? Okay. And then as you're thinking about that, what are some of the things that you or others like you appreciate, enjoy, like about your work? And what, if anything, do you not like so much, if you're being honest? All right. Anybody want to go first?
I will, since I'm willing to go first.
Sure, go.
Well, again, I've been with the cabinet for 28 years. I started out on the front line, initiating investigations, ongoing services. My career has touched a lot of areas in our agency over my career, and so my experience has been rich, fulfilling. But the typical day for a social worker, it depends on really where they are stationed, what team they're in, because in our agency, especially in Jefferson County, we have investigative teams and we have ongoing teams. And then there are ongoing teams. Our ongoing teams, some of them are housed in what we call neighborhood play sites. But not only do we have ongoing teams, we have recruitment and certification teams, our RMC teams that are active and engaged in recruiting prospective foster and adoptive families, and also responsible for finding placements for youth who have to come in foster care. And we also have an adoption team. And so the adoption teams, they do the work of trying to get our children adopted. And so if you're in investigation, the typical day is that, social workers work 8 to 4:30 p.m. Those are the standard hours. I'll say that. They will typically get a referral from centralized intake that has already been reviewed and screened by their supervisors at the morning meeting. And then that particular referral, which is oftentimes referred to as a DPP 115, that referral will have an initiation time frame. It'll, either be a 4-hour initiation time frame, a 24-hour initiation time frame, a 48-hour initiation time frame, or 72. And so depending on the initiation time frame, they have to go out and make contact with the alleged victim in order for it to be considered an initiation, because that's what initiation is defined as. And, according to our statutes and according to our SOP, it's contact, face-to-face contact with the alleged victim or victims. And so they'll go out, and depending on how many investigations they may get, they may get one or they may get two. In some instances, sometimes, depending on how we staffing in our agency, and lately, since our staffing has gradually picked up, it's usually maybe 1 or 2 investigations that they may get in a day that they have to go out and initiate their investigation. And so they would go out and complete an assessment with the alleged victim, and write that assessment up. Depending on what they see when they get out to the alleged victim, they'll call their supervisor, who is a family services office supervisor, whom they will consult with on what next steps need to do. If they get to a point to where they want to, take a case to, they can, if they need to, they could, file petitions for court action. It just depends on how serious the allegations are. And so that's typically what a social worker will do in investigations. Now, in ongoing services, ongoing gets their cases from investigation. So the case is transferred from investigations to our ongoing services team. And so our ongoing services teams, typically what they'll do is they'll pick up where the investigative teams left off. And so usually those cases, for the most part, tend to be court active cases with active court orders. The children may or may not be out of the home. And so the ongoing social workers, they typically have a standard of 3 to 5 days to make face-to-face contact with the family. And what they do is they go out, establish contact with the family, the child, and develop a case plan with the family, go over the court orders and any necessary things that they need to be doing as far as perhaps referrals for, let's say, drug screenings, or family counseling, individual counseling, whatever they've been referred to, in-home services. And the social worker will pretty much go over those particular aspects of the case with them. And for ongoing services, in comparison to investigation, there's typically more time to plan out your day versus being an investigation. If you're somebody who likes a fast-paced day, where you're out and about in the field, knocking on doors, engaging with families, investigations is, in fact, the job for you. If you like to plan out your day, where you schedule appointments with families and go out and have an opportunity to do a lot of that kind of micro kind of work, then ongoing services is, it's probably something for you. But then sometimes with ongoing services, there may be some families where we have to look at alternative permanency goals, so explore alternative permanency goals. And so for some of those families, it may be looking at a planned permanent living arrangement kind of permanency goal, or for some children and families, it may be exploring adoption while, still offering those reunification services until there's actually an order signed that says that rights are terminated. But we really don't want to get to that point. What we want to do is work towards reunification. We want to work as much as we can to keep children with their parents in their homes. So we work towards return the parent, or we look at, as much as possible, placing a child with a relative. I mean, we're looking at relatives. So we have But we do have those situations whereby in some instances where, there are some children who are on adoption teams, and then there are some children who are placed on what we call our independent living team. Independent living teams our independent living team is a team whereby there are children who have a permanency goal PPLA. And so with these particular youth, you'll find that they're like 17 and older, and they are either looking at extending their commitment in order for us to continue to provide services for them, or some of them may decide, when they get 18, I'm done with foster care, don't want to have anything to do with social workers anymore. And so see you later, but they can still qualify for college tuition voucher. And then even up to their 19th birthday, they can, if they decide they need some additional support, they can recommit to the county. And you'll work with them to help them as well, to support them and provide them with the needed services as well. And so we also have what we call some sobriety treatment and recovery. We have a sobriety treatment and recovery team, which we call START. And we also have a family recovery team as well that is a team that we have started as well locally here in the region that works with families who have substance abuse kind of issues that are an active part of that particular case. And so it gives us an opportunity as an agency to kind of slow down the process and put some tailor-made services in place for those particular families in order for them to address, some of the issues that are dealing kind of align with some of the substance abuse issues to make sure that they're getting the treatment as well. And
I
so
think
again,
it's amazing.
so,
The integration of so many different service streams under one roof. And, the idea that the cabinet has created a division that's called protection and permanency, I think is so powerful. That always at the end of the day, the primary goal is protection of vulnerable children. But existing side by side with protection is permanency, ensuring that vulnerable child or youth, young person has a permanent home, because we know that that's really important in terms of what their future is going to hold for them. And ideally that permanent home is with their family. But that's not always the case. And it's the job of the child welfare worker to find that place that is in the child's best interest. And so, yeah, thank you. That was a lot. And we're gonna keep circling back to dig deeper into that. But I wanna open it up to hearing from each of our other panelists, just a little snippet of a day in the life on the front line of your line of work. And if you want to add one thing that's an awesome part of that work, and one part that is challenging, or something that you don't like, if you want to be honest. Anybody else want to go next?
Sure, I can go next. So like I said, this position is kind of new to me, but I'm not new to the advocacy space. I started out as a volunteer in 2018, kind of focusing on like criminal justice reform as a justice involved person. And so it's kind of, molded me into the person that I am today. But a typical day for me, especially as a newbie, kind of revolves around a lot of reading and research. And I enjoy that. I know a lot of people don't really enjoy that, but I think especially in the policy space, you have to know the ins and outs of the Kentucky legislature. You need to know about the administrative regulations and Kentucky statutes, and it can get a little weedy. But like Kentucky Voices for Health, we primarily focus on access to healthcare and healthcare barriers. That could be transportation, language barriers, different things like that. And I chose this organization because it encompasses all social work levels with the micro, meso, and macro. And so we hold like listening sessions, like our last one was held at the Americana Center here in Louisville. And the community health workers there had some people from the community come in and talk about barriers to non-emergency medical transportation. And so just like a basic example is these brokers don't offer like a complaint line. So there was a lot of unethical stuff happening, and there was really nowhere for them to call for these complaints to be processed in a correct way. And so from a very, very basic, like micro level, we also have a contracted connector that works on the ground. If they have issues with the Medicaid process, with enrollment or eligibility requirements, we have somebody there that's able to help them kind of navigate that process. And then also informs policy, because whenever there are issues that we need to address on an administrative level, like we hear from the people, like we don't just assume we know what they need. Like we have people on the ground that are actually working, and we're helping navigate these barriers. And it takes it all the way up to a policy perspective. And so it's a lot of research, a lot of reading, a lot of meetings with other stakeholders in the community. KVH is part of the coalition, so we work with the Houseless Coalition. We work with the Kentucky Center for Economic Policy really closely on a lot of issues. They kind of give us all the numbers and data that we need. And so it's not just about sitting in a legislator's office and kind of pitching ideas for bills. Like it's a lot of research and reading that goes into it, and a lot of groundwork with people in the community across the state. And we also, KVH offers CEUs at our roadshow series. So we'll go to every corner of the state. A couple of weeks ago, we went to Covington, and in attendance, we have a lot of community health workers and social workers that come there. And we have explainers for them about our different policy perspectives and things that we're working on. And we ask for opinions from them also, like what can we do? What would be helpful in the healthcare space? So I think
to shine a light on something that you said, Brittany. Just the other day when I was working on my social work degree, we actually had to identify whether we wanted to focus on micro level, in other words, one-to-one kind of social work practice, or macro level, which is the, systems, policy, planning, advocacy. And we've come to learn in the years since I was in a social work education program that is an artificial divide, that it's on all of us to think about what parts of the system are broken, that we can actually get up to that level and fix it. So we're not doing the same fix over and over and over again for individual clients. On the other hand, folks that are doing that kind of work really have to be connected all the way to the front line to have that lived experience. And so Brittany is, just a great example of somebody who's really walking on both sides of the street. And her agency is doing such a good job at making those connections. And I think that's super important. Emily, Pat, want to jump in?
Yeah, I'm happy to. Like Brittany, I also do micro, meso, and macro work. Mostly I'm here in the hospital, and I assist patients with spinal cord injury or illness to get back to their lives after a catastrophic injury. I see them across the entire continuum of care, which is very unique. That is not done anywhere else in the country, so that's kind of cool. So I see people from the acute care side in the hospital, right when their injuries or illness are discovered, and then they come here for inpatient rehabilitation. And the inpatient case manager works with them mostly, but I'm kind of in the background, getting to know them, becoming a familiar face, working with their caregivers. setting them up with transportation, talking about housing and equipment ordering. And then hopefully the idea would be that they would come back to us for outpatient as well. And that's where I shine. I do the most work on the outpatient side and within the community. So I help people adjust to their injuries mentally and emotionally. Not only them, but their caregivers and family members as well. I also help connect them with community resources to be able to get back to what they were doing prior to their injuries, whether that's, exactly the same as it was or a little bit different with adaptations. So I'm connecting them to return to work, school, leisure activities. I work with a lot of different stakeholders within the community to do that. Let's see what else. We also have our patients come back annually, and so I'm really with this patient from the time their injury or illness happens until death. So I really I really form a pretty strong bond with these people, which is really awesome. And then on the policy side, I advocate for them. So, as Brittany said, there's a lot of issues with transportation and housing accessibility and, caregivers and things like that. And so I advocate in Frankfurt for those changes in policy as well. I also have administrative roles, so I work to do program improvement and we just were acquired by UofL Health in 2019, and so we're growing and moving and shaking, and it's really awesome. We've just hired another social worker and another nurse navigator, so we're training and expanding by leaps and bounds, so that's pretty great as well. I worked with a multidisciplinary team, doctors, nurses, therapists, very closely with everybody to ensure that the patient has everything that they need and gets what they need.
I want to shine a light on, I think, a couple of things that you brought out so beautifully. One is that balance of very practical help, like, transportation, access to, financial support, equipment, but also that social emotional side of all of these transitions in life that we're pointing to. And, a spinal cord injury is a very dramatic, often, transition in life. So a social worker being able to show up and be present to the whole person and very strengths focused. What really stuck out to me is when you said helping them get back to the things that they enjoyed, because they're the same person. They have a different body capability now, maybe, but that same person is still inside. And social workers are all about seeing that person and working with people in other disciplines who may be trained to look at people differently. We really bring that strengths focus to the table. Hey, Pat, talk to us about what you do.
Okay, I'm glad to do that. So I've had a long career with working with individuals that have drug and alcohol problems. I've worked in various settings at Volunteers of America. We had a massive department where we served women with children, incarcerated individuals that had dual disorder kind of things, coexisting. We provided everything from intensive outpatient to residential treatment, transitional care, follow-up care. So I have a lot of background in that, and I've moved away from that level of intensive work. I used to run a recovery house. I had a place called Silver Solutions, but I closed it a couple of years ago. And over the years, I've developed what I consider to be a very niche sort of professional operation where I work with organizations with employees that have drug and alcohol problems. That's mostly what I do. If they fail a drug screen on their job, or they come in and they say they're stressed, or they're not really sure they can handle their work because of some kind of personal issue, they'll call me. I will make an appointment with them, and then I work with them, and I bill their employer for their time. And so I also do the same kind of thing, except I have like an individual private practice, and I work with families. And it's all outpatient, and it's very nice to be at this place where I can just kind of do that and sort of pick my own hours, kind of thing. It was sort of a dream of mine to be able to have like this flexibility in my life at some point. So after years of putting in all kinds of time with different organizations, including the state, and being on call 24 hours a day, 7 days a week, running a recovery house, I've kind of moved into a little bit less of an intensive role with my work. But if you want to do private practice, you do not have to wait as long as I did to actually do this. I mean, there are many, many, many of my colleagues that when they graduated with their master's in social work, they got their LCSW, they opened up a private practice, they specialized in the area that they really wanted to deliver, not just alcohol and drugs, whatever it might be. And then they conducted business as an independent practitioner. But I do supplement my work with teaching at the university. I teach for Spalding. I teach for University of Louisville. I'm a part-time professor there. Or an adjunct professor. They changed the language. I teach for a couple of other schools. I do psychology courses for them. So, I've just sort of created my own little way of not really having to leave my house very much and, make a living.
Okay, here's what I want to shine a light on. Pat, you've really introduced the idea of social workers working in private practice, often combining a focus on mental health and well-being and also on addiction and recovery. So there is a pathway within social work. Pat mentioned the LCSW license, the licensed clinical social worker. In Kentucky and Indiana, there are actually 3 levels of licensure. So you can be immediately licensed as soon as you finish a bachelor's degree. In Kentucky, that's called the LSW license. That allows you to practice as a social worker right outside of the gate as soon as you finish your bachelor's degree, which is unusual among the helping professions, right? After you finish your master's degree, there's a higher level of licensure called a certified social worker, or a CSW. And then beyond that, with some hours of supervised clinical experience, you can take one more level of licensure exam. It's called the LCSW, Licensed Clinical Social Worker. And then you are licensed to practice independently as a clinician, which means you can have your own private practice. You can be a member of a group practice. You can work at a place like 7 Counties or Family and Children's Agency. You can diagnose and treat mental health and addiction disorders. And you can bill insurance, Medicare, Medicaid for your services. So some people think, oh, I need to be a clinical psychologist, or I need to be a medical professional in order to do these things, and don't realize that social work has that direct pathway to clinical social work. The other thing that Pat, I want to shine a light on there, is his real focus on the person in their environment. So he's talking about providing one-on-one services to people who have mental health or addiction related needs, right? But seeing them in the context of their family, seeing them in the context of their workplace, seeing them in the context of their community, that's another unique focus of social work education, is really not just seeing a person with problems, but seeing a person who is interacting with all these systems around them, for better or for worse. What can we do to draw out the resources and the strengths of those systems around them, and also address some of the problems in those systems? Let's go all the way back to Billy, locating where the problem is. And I can tell you who for sure the problem is. It is not the abused child, right? So that may be his client, but we're really looking at all of what's going on around. Y'all, it is 12:23. Time has flown. I did promise you I would show you what the career prospects look like. So I'm going to show you this real quick, and I'm actually going to publish a copy of this video if you want to go back and look at it. But the bottom line that I really want to make you aware of is it is an excellent time to be thinking about becoming a social worker or continuing along your career pathway, because the job is growing. The need for social work is growing in all sectors of social work. These are Department of Labor categories, so I didn't pick these in particular because I prefer one brand of social work over another. But I want you to see the median salary, and these are 2023 figures. So a lot of people think that, oh, I'm going to be living poverty wages, and it's a sacrificial decision to become a social worker. And especially if you continue along that pathway to the master's degree, you really can earn not a wage that's going to make you rich, but definitely a wage, and more importantly, the kind of work that can give you a satisfying life. So as we close out today, I'll ask any of our panelists, in a word or a sentence, do you have any closing thoughts that you want to leave people with? Emily, I saw your microphone go on. Do you want to?
I don't know. I think just, in my experience, social work has been very versatile for me. So, if you start out in something and you enjoy it, but you want to explore something else, you can. It's really phenomenal. And I think, you can build it the way you want to build it. There are so many needs in the world today that if you see a need, make it happen. You don't have to just, apply for a corporate job and work for a corporation or an organization. You can do what you want to do. That's what makes social work so awesome.
Thank you. Pat, a word or a phrase to close it out?
Yes, I agree. While I don't have a master's of social work, I will tell you that I agree completely with Emily. It's a very versatile degree. It has great recognition. It has an amazing, diverse amount of opportunities, depending on how you want to structure your professional life. And the beautiful thing about the MSSW, if you get a master's or you go on, is that if you go an administrative route and you get tired of that, you can always go back and just do some clinical hours and get a license as a clinical social worker with the same degree. And you don't have to go back to school and get another degree. You just diversify your skill set in your experience. So, I really do encourage individuals to consider that when they're shopping degrees, especially if they're at a place where they have some ambivalence about what exactly they're going to do. Then give yourself the most amount of options.
Excellent. Billy, how do you want to close it out?
I would say social work provides anyone and everyone who is interested lots of flexibility to serve families and vulnerable populations. And so love social work, love social work students. And so it really is a great opportunity to serve.
Thank you. And Brittany?
I guess I'll use my time to make a little plug for Spalding specifically in here.
I did not cue this up, I promise you.
I know. It's just on my heart to say, because, we have people on the call today that are in the same position that I was when I left JCTC. And I don't know which university to pick. I don't know if social work is the correct career path for me. I'm not really sure what this is going to look like. And what I will say to people that are on here that are kind of in that same space that I was a few years ago, Spalding has offered me a chance to really connect with my classmates. And in doing so, because we have smaller class sizes, in doing so, not only have I made friends, but I've been able to practice a little bit of kind of networking. A lot of my classmates are already working in the field, so we're able to bounce ideas off of each other. And I have spoken to other people that have gone through UofL, and they complain to me about things like that. Our class sizes are so huge, and I don't feel that it's personal. So if you're on here and you're wanting that more personal approach to your education, Spalding is definitely the way to go. And when I first entered JCTC, I have a non-traditional education path, so I didn't even have a high school diploma. I had to get a GED first, and was leaving a treatment center, and so if I didn't see myself in policy work is what I'm getting at. I thought that I would be kind of like Pat and that I was going to work in treatment for the rest of my life. That's really what I wanted to do. And I was drawn to something different. So I guess what I'll end with is definitely keep an open mind to where social work is going to take you, because you might have some ideas, but I think the universe has a funny way of drawing us where we need to go sometimes.
Wow. Well, I think that is just the perfect place to leave it. Sarah, Paula, Sanrisa, thank you for being here today. I hope you got what you needed. Emily, Billy, Pat, Brittany, you're awesome. Thank you for giving an hour of your time today, and for just the wisdom and experience that you shared today. It's inspiring. I think it's helpful, and I appreciate each of you. All right, that is it for today. My number, I will put down here in the chat, but it's 502-873-4477. And you can reach me at sdeck@spalding.edu. That's Stacy Deck, D as in David, ECK. So if you have any follow-up questions, what I'm going to do, it'll take a minute to produce this video, but I'm going to post it on our Facebook page so that folks who didn't get to see it, I'll make you famous. And if you know of anybody that you think could benefit from this information, for sure, feel free to share it. Thanks again for being here, y'all.
Thanks, Stacy, for inviting us. Nice to meet you all.
Yeah.
Thank you.
Goodbye.